I feel such joy, I really do. I literally, when I saw it, I just was dancing around the kitchen, a bit ridiculous, but yeah, I was very happy.
That joy has come after 12 long years of campaigning for better maternity services in English hospitals. 12 long years in which Rhiannon Davis and her husband Richard often felt as though their concerns were being ignored.
Along the way, did you feel like people were trying to shut you down, trying to get you to go away?
We have been closed down, we have been told lies. I'm personally really proud that we've persevered, and we've done that, I think, in Kate's name.
Kate, their baby girl, died soon after she was born in 2009. The Health Service Ombudsman found that the death was avoidable and that there were serious failings by the Shrewsbury and Telford Hospital NHS Trust.
She should be 12 years old today. I think the loss of a child is something that affects you for the rest of your life. You shouldn't have to bury your children or cremate your children as we had to with Kate. And when we found out that Kate's loss was absolutely avoidable, that makes it that much harder.
An independent review was ordered into the trust, led by midwifery expert Donna Ockenden. Her initial findings described one of the biggest scandals in the history of the NHS. It found nearly 2,000 serious incidents, including hundreds of baby deaths. West Mercia Police launched investigations into the worst of the cases. And today, a meeting of the NHS Improvement Board announced that £95 million will be spent to improve maternity care in England.
We need to look at workforce numbers, culture and leadership, and strengthening the surveillance of our trusts.
What are you hoping will come of this money?
NHS England have listened to what Donna Ockenden's team have identified as critical themes, and they have committed to fund what's needed to solve a number of those problems. That's huge, and it will have a marked difference. Lives will be saved directly as a result of this.
Kate's parents campaigned with others who had lost their babies at trusts across the country, including East Kent and Morecambe Bay, where there have also been investigations. They lobbied for a review, which was finally ordered by the then Health Secretary, Jeremy Hunt.
£95 million. It's not a huge amount of money when you look at NHS funding. Should there be more?
As a kind of old-timer of these announcements, the thing I look really carefully at is this money recurrent or is it a one-off? And this money is actually recurrent. So it means that we're going to have about 1,000 more midwives year in, year out across the NHS. So even though it's a relatively small amount of money by NHS standards, I think it will make a big difference.
After more than a decade, Ms Davis and Mr Stanton say that they feel vindicated, but that the announcement is bittersweet. Hours after her birth, Kate had to be airlifted to another hospital.
Richard reached Kate and they basically removed her life support, and she died in his arms, and I was an hour away and I wasn't with her when she died. And that's one of the... I don't think I'll ever be able to accept that.
The Royal College of Midwives said the money is a significant boost for under-resourced maternity services. They've estimated that to provide optimal care, 2,000 more midwives are needed.